Hello everyone. In this video, we will discuss about biopharmaceutics related question and their tricks. The question is, which of the following drug bind to the albumin? Okay, first we will understand which drugs it will bind to the albumin and which drugs it will bind to the other plasma protein. The two important plasma proteins, one is the albumin, other one is the alpha-1 acid glycoprotein. Alpha-1 acid glycoprotein. So what is the nature of the albumin? The nature of the albumin, basic nature. This is the basic protein. So what is the nature of the alpha-1 acid glycoprotein? Yes, it is right. That is the acidic protein. In the name itself is there, acid. This is the acidic protein. Now the question is, which drugs it will bind to the albumin? This is the basic nature, so that acidic drugs will bind. Very simple, acidic drugs will bind. And which drugs it will bind to the alpha-1 acid glycoprotein? This is the acidic nature, basic drugs it will bind. Which drugs will bind here? Basic drugs will bind. Now, what are the important acidic drugs we have to remember? So, the trick is here swab. Swab. So, swab is the acidic drugs. What is the S? S stands for the sulfonamides. Sulfonamides having the acidic nature, it will bind to the basic protein like a albumin. The W is the warfarin. Warfarin. A is the aspirin. A is the aspirin. So aspirin is come under the NSAID, non-steroidal anti-inflammatory drugs. NSAIDs are generally acidic nature. They will bind to the basic protein. Okay, that is the albumin. So mefenamic acid, ibuprofen. Okay, so these all are the acidic nature. They will bind to the basic protein. And the B is the barbiturates. That B is the barbiturates. So the trick is here swab. Remember the swab? These are the most important acidic drugs. It will bind to the basic protein. On the other hand, what are the basic drugs we are having? So many basic drugs we are having that we can remember. The mnemonic is the Kabali. So just remember the trick is the Kabali. Everyone knows, very simple trick, Kabali. So what is the Kabali? K or the C, that is the calcium channel blocker. Calcium channel blockers. And the C stands for the chlorpromazine. Chlorpromazine. The chlorpromazine is the antipsychotic drug. It will bind to the alpha-1 acid glycoprotein. The A is the anti-arrhythmic drugs. Anti-arrhythmic drugs. Anti-arrhythmic drugs, it will bind to the alpha-1 acid glycoprotein. B is the beta blockers. Beta blockers. A is the alprazolam. Alprazolam. You know that alprazolam is the benzodiazepine. Benzodiazepine. And L is the lignocaine. Lignocaine. Local anesthetic. Lignocaine is the local anesthetic. And I is the imipramine. I is the imipramine. Okay. So imipramine is the tricyclic antidepressant. This is the amine. Amines, it will bind to the alpha-1 acid glycoprotein like acidic protein. Last one, we are just remember opioids. Even opioids also bind to the alpha-1 acid glycoprotein. You are just remember the mnemonic is the Kabali. So Kabali is the drugs which binds to the alpha-1 acid glycoprotein. So what is the question now? The question is, which of the following drug bind to the albumin? So albumin is the which drug? Albumin is the basic protein. So acidic drugs will bind. So imipramine, amine, this is the basic. It will not bind. Kine, lignocaine, Kabali mein L, lignocaine, this will not bind. Chlorpromazine, Chlorpromazine. So chlorpromazine also basic drug, it will not bind. We want acidic drug, barbiturates. Yes, in the swab, B is the barbiturates that will bind to the albumin. Okay, so remaining these all drugs are the Kabali. So Kabali means basic drugs, they will bind to the acidic protein like a alpha 1 acid glycoprotein. So that is how to remember the simple thing. Okay, thank you everyone.